Welcome back. Time for some 8-1 for your health. We are here today touring the Breast Care Services Department within Penn Highlands Healthcare in Tyrone. We've got Angela here, who is an RN and a nurse navigator. We're going to get to that in just a bit. But we've also got Leah here, who is a supervisor within the department, talking all about the importance of Breast Cancer Awareness Month. It is October. You deal with all sorts of, issues with this, getting people checked up, of course, their mammograms. Why is it so crucial to get these checks?
So mammograms are the first step in preventing breast cancer. It is a preventable disease, and it is the screening process that prevents these cancers from being undetected. They can be detected early before you even feel a lump. So that's why we recommend the yearly screening mammograms.
And what is the age range that you typically recommend someone start this type of process?
So we follow the American College of Radiology, also called the ACR, and the Society of Breast Imaging guidelines. And women over the age of 40 should be beginning to have their screening mammograms starting then. Of course, unless there is a problem or you have a complaint or you have a strong family history, which would put you into a high-risk category, and then you would want to start earlier. And obviously, we're always happy to answer any questions because it can be confusing trying to determine when you should start. And that's why we have our breast care navigators to help with that as well.
And this is an annual thing that once you begin, you kind of want to keep on top of?
Yes, correct. You always want to do annual mammograms. Breast tissue can change rapidly from year to year, so you always want to do it annually.
Okay. And so, Angela, with you as a nurse navigator, what exactly does that mean for this department?
For this department, I'm here to help patients through their journey, provide education on their diagnoses, and also help with scheduling appointments and follow-ups, things of that nature.
Very good. And I know we're going to go and, kind of check out some of the equipment that you use here. And I mean, what is the process typically like as far as setting up an appointment? Are there do's and don'ts when you're doing something like this? Obviously, you're kind of put in a vulnerable situation. You might be a little scared.
Yes, super easy to schedule. We actually just started our book online. So anybody at any time at their convenience can get onto our website, and it's super easy to follow. And you just click book your appointment for your mammogram. You can select the location. All of our locations offer the highest technology, the most up-to-date 3D mammography, which is definitely recommended. We are an accredited system. That's all. You always want to go to an accredited facility because we have to follow certain guidelines. But you can book online at your convenience. There's a list of times. Nothing to be nervous about. It's very easy. I've had one. We've all had one. Not painful. Totally an easy process. And with the 3D imaging, it gives the best pictures for the radiologist to be able to detect any abnormalities.
Yeah, that's wonderful, too, that you do some of the hand-holding, and make it easy for people to, want to do this annually, encourage them to continue that process. I mean, I'm sure it's pretty crucial to pick a great place, to have these services done. What do you think makes Penn Highlands Tyrone such a, great place for that?
So, as I said, we have the most up-to-date technology. We have very amazingly trained breast radiologists, having our nurse navigators. We also have the Volpara high-risk assessment software. So this is going to... It's included in your test. It's not an additional charge or anything like that. What we do is we ask questions about your history, and then that software actually detects your breast density, and it gives you a percentage, a score. So anything above 20%, you would be considered high risk, and there may be additional screening that is needed. And we are very knowledgeable about that, and we work to help like insurance cover additional charges like that. So it's a very thorough process. You're with us from the start to the end. With your screening mammogram, we call results. You get a letter with results. And if there would be anything abnormal, that's where our nurse navigators step in and educate and take care of and really make the process as smooth as possible, because it can be very, very stressful for patients because it is a sensitive area.
We oftentimes associate breast cancer with women being a women's issue, but this is something that men can develop too. Is this something that you recommend for men as well?
So with men, we only do them if they have a problem, feel a lump, have pain. It is very rare. It's only about 1% of the population of males that have breast cancer. That doesn't mean that they can't get it though. I've actually seen quite a few cases, and it can do with like a gene mutation, family history, and then sometimes it is just sort of a sporadic thing that does happen with certain cancers. So men cannot get screening mammograms like with insurance, but if they have a problem, it would be a diagnostic, and then we would get them taken care of.
But definitely something to make sure you're staying on top of if you are within those age requirements, or if it isn't, your family history, or of course you just notice that something's not right. You're the biggest advocate, for your own body, and if something's doesn't feel right. Yes. If people would like to make an appointment or see about, getting on board with the process of starting something like this, what's the best way to reach out?
So like I said, you can do the book online if, everybody's busy, everybody's working, to pick up the phone and call. And especially in this technology age, it is nice to just kind of get on and, book that appointment so you at your convenience, you can pick the time. You can also call our central scheduling, and they are happy to help schedule at any location. They're very helpful with that as well. And we have next day appointments, our appointment availability. That is a big thing for me, that I always make sure that we have appointments at all of our facilities as quick as possible. And of course, if somebody needs in sooner, they can always contact me, and we can work with a schedule to make it accommodating for the patient.
That's wonderful to hear. Anything to help make the process easier and encourage women to, put themselves first, take control of your health, and of course the scans and tests that you need to, put your health first. And this is a great place to do it. We appreciate you giving us a behind the scenes look at everything. And yeah, again, we just encourage you to make the appointment this month, October Breast Cancer Awareness Month. It's an important thing to do.